About 1 in 10 Americans have diabetes, and many people don't even know it. As part of Diabetes Awareness Month, Touro internal medicine physician Dr. Schuyler Williams joins us to talk about the risk factors along with some tips for people living with diabetes. Hi, Dr. Williams. Good morning.
Good morning. Thank you for having me.
Thanks for joining us. So what happens inside the body? If you've got diabetes, what exactly is going on inside your body?
Well, as you mentioned, diabetes is a common chronic medical condition impacting 1 in 10 Americans. To understand the disease, it's important to recognize the role of a hormone named insulin. Insulin is responsible for regulating the amount of sugar that is in your bloodstream. And if you have diabetes, there's trouble with how insulin is working. So over time, we can see that this can lead to some other medical problems, such as heart disease, kidney disease, and even vision loss. So it's important to be aware of.
I was surprised to find out that diabetes is the 7th leading cause of death in the United States.
Yes, that's exactly right. Long-term diabetes can affect multiple organ systems, most importantly, the cardiovascular system. People who have diabetes are at high risk for strokes, heart attacks, and other medical problems. So it's important to, if you have risk factors, be screened for the disease. And if you have diabetes, to make regular visits with your provider to be sure there's no evidence of progression, and so that your provider can continue to screening for all of those important complications we see with diabetes.
What are the risk factors that if you have one, you should go to your doctor?
Well, for type 1 diabetes, the major risk factor is having a family history of the disease. For type 2 diabetes, the risk factors differ a bit. Some important ones to keep in mind are if you are overweight or lead a sedentary lifestyle, if you get limited physical activity, or if you're age 45 and over.
Okay, and then there's a third type of diabetes, gestational diabetes, right?
Exactly. Gestational diabetes is diabetes that's diagnosed once you are pregnant. Your OBGYNs during your pregnancy, they will screen you for gestational diabetes during certain trimesters in your pregnancy.
And if you have gestational diabetes, that doesn't necessarily mean you're going to have it after you have the baby.
Not necessarily, but we do know that if you're diagnosed with gestational diabetes, that your future risk of developing type 2 diabetes is higher than the average population. So that's why it's so important that we continue these screenings for the disease.
Absolutely. All right. Well, Dr. Williams, thank you very much again for joining us this morning. We appreciate it.
Thank you so much for having me.